Hello, my name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Song Brown Registered Nurse and Licensed Midwifery Informational Webinar. Before we begin, I want to make sure everyone knows who this webinar is for. Today's webinar is for new and continuing applicants to the Song Brown Registered Nurse and Licensed Midwifery Program. The program provides grant opportunities that result in funding for organizations to educate and train providers in these professions to work in underserved communities. Here's the agenda for today's webinar. We'll do some housekeeping and introduction at the beginning with me, and then we will go into the registered nurse and licensed midwifery updates, the application process and requirements. That will be with Castanina Vall, and she's the program officer for these programs. And then at the end, we'll have some time for question and answers. And so let's jump into those housekeeping items. Number one, this webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the camera, microphone, chat, and view controls in the menu bar at the top of your screens. Number two, the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And number three, this webinar will be recorded and will be available within 7 to 10 business days. And with that, it's my pleasure to introduce Castanina Vall, Song Brown Program Officer.
Good morning, everyone. Thanks, Chris. So before we start on the actual information for the applications, I'll tell you a little bit about Song Brown. So Song Brown provides funding to education programs, including family nurse practitioner, physician assistants, registered nurses, primary care residency programs, licensed midwiferys, and certified nurse midwifery. As Chris said earlier, we do provide financial incentives to programs who graduate individuals who practice in medically underserved areas, enroll members of underrepresented groups in medicine to the program, locate the program's main training sites in medically underserved areas, and operate a main training site at which the majority of the patients are Medi-Cal recipients. So our application dates and deadlines are here. So the application is open now as of October 24th. You have an early submission deadline on November 21st, 2024 at 3 p.m. And the final application deadline is December 5th, 2024 at 3 p.m. So some things to know before you apply. If your program does require an approval to contract from a coordinating authority, please inform your authority of those terms and conditions contained in our grant agreement. Samples of those grant agreements are available on the Song Brown website, and you can access that in the grant guide for your respective programs that you're applying for. Applicants must agree to all terms and conditions before receiving those funds, and we will not be making any changes to those terms and conditions specified in the grant agreements. Song Brown funds shall also not supplement existing federal, state, or local funds that your program is receiving. Some new changes for 2024, of course, are two big changes is the new program pathway for RN. This is to financially support organizations who are in the process of receiving BRN approval or Board of Registered Nurse approval for your program. If you are a new program, this is for you. And of course, our new licensed midwifery program pathway is to financially support licensed midwifery programs who are in the process of receiving Midwifery Education Accreditation Council accreditation or the Medical Board of California approval. So those are our big changes for 2024. So for information to gather for RN, please make sure to gather your grant agreement and payee data record signatories. They will be the people who are authorized to sign and enter grant agreements with HCAI. The thing I want to emphasize the most here is ensuring that your organization name and or doing business as name is as listed in your IRS W-9 forms, as those are the ways you will be paid if you were to be awarded. You will also need to collect and gather information for any training sites used in the academic year 23 and 24. You will also need your student information for any students academic year 24-25 and 25-26. This will be gathered in aggregate only, no student names are required. For graduate information, we will need your graduates from academic years 21 and 22 and 22 and 23, including their practice site, location, race, ethnicity, and for the entry-level master's program, your NPI number for those students. We will also require the Board of Registered Nursing program approval letter and/or BRN program expansion approval letter. I'll get more into detail on that in the required document section. For licensed midwifery, just like the RN, you do need an authorized person for grant agreement and payee data record signatories. You will also need your correct organization name and doing business as, if needed, according to your IRS W-9 forms. You will need the name, facility type, and address for any anticipated or collected training sites, and your Midwifery Education Council program accreditation timeline or the MBC approval timeline. All right, so those required documents, again, for RN and LM are listed here. I want to highlight the expansion piece for BRN. That letter should tell us the number of approved expansion slots for your program. So when you upload that letter, if you are an expanding program, please ensure that it does have the number of approved expansion slots somewhere in the letter. For our new programs, for the RN, a BRN approval, MEEC accreditation, or MBC approval timelines, this is just going to tell us the planned schedule for securing those accreditations or approvals. So it's going to tell us the phases or timelines that you need for those approvals and accreditations. And the other required document for our new programs is the sustainability letter. This is a letter from your host organization that endorses your program and speaks to the sustainability of your program beyond Song Brown funds. All right, some helpful resources here. Our HCAI application will be linked in the chat, pinned to the top, along with the other resources. The Song Brown RN grant guide, scoring guide, and evaluation processes will also be linked in the Song Brown website under the registered nurse section in the website. The licensed midwifery grant guide, licensed midwifery scoring and evaluation processes will be linked in the midwifery section of our Song Brown website. And for any terms that you may need to know for our application, that will all be found in the Song Brown glossary, also in the resources tab of your respective programs. All right, some helpful tips for the application. So to navigate the application, we have two blue buttons that will appear throughout the application. You have the previous button. This will help you navigate back and forth between your pages if you ever need to go backwards and review that information again. And then the Save and Next button, the most important button of them all. Every time you fill out a section of your application, you will select Save and Next to make sure all the information in that section is saved and stored. If you were to save and next and exit your application, you will find all of your saved applications under the Grant Application tab in the HCAI funding portal, and then you will select your respective program that you wish to retrieve your application. You will see red asterisks on the side of the fields that are required. So if you see an asterisk next to a field that we are asking for, that means that that information is required and you need to fill it out before moving on to the next page. The other tip you will see next to those fields will be a blue circle with a white question mark. And this just provides more information on what we're asking for and what we're looking for in that specific question. Now let's do a walkthrough of the existing and expansion application. This is a step-by-step, page-by-page walkthrough of the application, exactly how you will see it when you open it. So the first page you will see is the program information page. This first section up top will pre-populate directly from your profile page. So if there's anything that looks amiss or looks wrong and needs to be corrected, please exit the application and go back to your profile page and correct any of that information that you need to correct, and then come back into the application and it will be corrected up in the top here. The next section will be here where you will select the program type that you are going to be applying for. Here you will select the training program title. If you are a returning applicant, most training programs will be found with the magnifying glass on the right here with the arrow pointing. You will search for your training program. If you cannot find your training program or you are a new applicant, you will select training program not listed, and that will allow you to enter your training program title and the address for your training program. For existing and expansion programs, you will select if you are an existing program or if you are selecting expansion, and each of these checkboxes must be selected in order to move forward with the application. This is the contract administration page. This is where it will be handy for you to have that W-9 IRS form close by to make sure that your contract organization name and or doing business name matches that Internal Revenue Service form, the IRS form. Please make sure that your entity type is identified as governmental or non-governmental. Your contract admin is the main administrator for this grant. They will be signing or they will be in charge of managing the grant. They will be the primary contact for the grant. And then your grant agreement signatory must be an authorized individual to enter into the grant agreement and sign all of your grant documents if you were to be awarded. Please make sure that the first and last name of your grant agreement signatory, as well as their email, is correct, because if you were to be awarded, the grant documents will be sent to them via DocuSign. If your institution or your program does not have a DBA on your IRS W-9 form, please do not enter anything in the DBA section. This is the second half of that contract administration page regarding the STD 204 signatory. If you have a different STD 204 signatory to your grant agreement signatory, you will enter their information in this section here. Please again make sure that their first and last name and their emails are spelled correctly, as that is where all documents will be sent if you were to be awarded. The next section will be the address listed on your W-9 IRS form. So if it is a PO box, you may select PO box there. If not, enter the address as needed based on what is on your IRS forms. Please verify all of this information with your finance or contracts office to ensure that the information is accurate, and providing incorrect information will delay your grant should you be awarded. All right, this is the program description page. This is where you will tell us a little bit about your program and how your program follows the missions and statutes of the Song Brown Grant. You have 2,500 characters to complete this program description. It will tell you if you have exceeded your character limit. It will give you an error message. If you are copying and pasting a text from another document, please make sure that it does not get cut off and all of the information you want to provide is copied over. Again, it will tell you that you have reached your maximum of 2,500 characters, but always double check your program description page to make sure that all the information is captured. The next page will be the program data page. This is where you will inform us if you have student and graduate data, student data only, or if you are a new program with no residents, students, or graduates. This for RN, we do allow for you to import graduates and training sites from previous applications. So you will select yes or no in the import data question in the middle here. From there, you will tell us, based on the program data option above, what year you admitted your first set of students. If you have any 22, 23, and or 21, 22 graduates, you will be selecting student and graduate data. If you have no graduates in the year of 2022 or 23 or 21 and 22, you will select student only. This is our training site page. So this is our first page where you will be scored. So this is a part of the scoring criteria. So it is very important for all the information on this page in particular to be carefully reviewed, and all the information should be accurate. So you will enter the program's current percentage of total clinical hours spent in RNSAs. You will add your training sites using this blue button here that says Add Site. A pop-up will appear when you select that. And then if you need to edit or delete any training sites, you will select this white box with an arrow, and that will allow you to edit or delete. If you are importing training sites from previous applications, all of those training sites will be in the training sites with errors section here that will be in red. You will need to review and use that edit button for all of these training sites to make sure that they are accurate and that they're still correct and that you still use them. So I'm going to go over to the next page and show you what that pop-up will look like. This is what that pop-up will look like once you press add a site. You will enter your training program name and address here. This is also what it's going to look like with the training sites that you imported, and you will make sure all of the information is still correct. Address, training site name, and the NPI for that site. Once you're done entering and or reviewing that training site information, you will select data reviewed for accuracy. This is just telling us that you read through the training site and made sure that everything is correct according to your information. And that will make sure that the training sites get pulled down to the training sites with no errors section, which will be green. The next page will be the program expenditures page. You will need to complete all of these sections here. The first section up top is telling us how many slots you're requesting for this application. You have your existing slots here up to 30, and you will select that, and it will pre-populate multiplied by the maximum dollar amount per slot, and then total funds requested. If you are doing an expansion, the expansion slot section will also pop up here, and you will select how many expansion slots you are requesting for this cycle, and that will pre-populate here, giving us a grand total of funds requested down here. This bottom section will be your expenditures from the academic year 23-24. Personnel, operating expenses, major equipment, and other costs will be listed line item here in the dollar section. All of those will be grand totaled on the bottom, and this total and the grand total for funds requested should be equal or greater to one another. So the total funds requested should be less than here or equal to. Moving on to the aggregate student data page. So for this cycle, we are only doing aggregate student data. We're going to ask the total available slots for your institution, the total slots of students that applied, and the total students that are enrolled. From there, we want a breakdown of how many students enrolled in your first year students enrolled and your second year students enrolled. That will automatically total to this number here. From there, you will fill in all of the race ethnicity data in the bottom, and that total at the bottom should equal the total in the first section of the aggregate student data page. Make sure those are equal. If they are not, you will get an error message, and you can edit and review as needed. This is also a scored aspect of your application, so please make sure that this is accurate to your data that you have for your program. The next scored aspect is the graduate data page. This is the other section that can be imported from previous applications. We are asking for 2021-22 graduates and 22-23 graduates. You will inform us of those two graduate years and how many graduates are in each of those academic years. From there, if you have imported graduates, they will pop up in the graduates with errors section as it was in the training sites, and you will need to review and edit or delete as needed using that white box arrow to edit or delete. If you need to add some graduates, you will select add a graduate, and this pop-up will appear. Here you will enter the graduate's graduation year, 21-22 or 22-23. You will enter their first and last name, gender, race, ethnicity. If you are a ELM program, you will also enter their NPI and their specialty. Now, for those who are BRNs or BSNs or ADNs, you do not need to enter their NPI, and you will select no in the NPI question. However, the practice specialty section is required. Please just answer to the best of your ability. We understand that not all BSNs or ADNs will have a practice specialty. Please answer to the best of your ability, as it is a required field regardless if they are a ELM or not. You will then enter their practice site information. So the practice sites for your graduates are a scored aspect of this application. So please make sure to gather as much information as you can from your graduates. If you know their practice site within the state of California, if they are not within the state of California, you will select no and select whether they're out of state or other if you do not know. The last page where you will enter data is the required documents page. This is where you will enter that BRN approval or expansion letter for your program. At the beginning, the box will be red, notifying you that it is a required field. And once you enter the correct letter with the correct prefix, it will turn green. So for the documents for the approval letter, it is APPR underscore and EXPAPPR underscore for uploading those two letters. This is the final page of the application. This is the assurances page. You will read the statement and click I certify. Once you certify and submit the application, you cannot make any further edits unless you were approved to do so because of early submission. So please do not click submit until you are ready to make your final submission for the application, as you cannot go back in and edit afterwards. All right, so now we will go into those new RN and LM application walkthrough. Again, this will be a step-by-step of those new program applications and page by page. So everything is as it is here in the application. So you will see that program information page as well. For this one, since you are a new applicant, you will select no in the question, are you a are you a previous Song Brown applicant? You select no. And that will give you the option to select new program. This you will also enter your title or your training program title here, as well as your address, and you will select the new program checkbox where you will check these two eligibility questions for your respective programs. Your program description is an executive summary for the new training program, including how your program plans to meet Song Brown statute priorities. Just like before, you have a maximum of 2,500 characters, and you will be notified once you have reached that character limit. Please make sure to review any of your program descriptions to make sure that nothing has been cut off prematurely. So for new programs, you will have 5 strategy questions that you will need to answer. So each of those strategy questions will have a series of checkboxes of the strategies that we are looking for within Song Brown. You will select the strategies that your program is planning to implement into your program. And after you select those checkboxes, a narrative will pop up and prompt you for an explanation on how you plan to implement those strategies. For new programs, the strategy questions are the 3 of the criteria for scoring. So strategy question 1 is a part of criteria 2. You will answer these accordingly and then enter some narrative about how you plan to implement. These two questions 2 and 3 are also part of criteria 2, and you will do the same. You will select the strategies you plan on implementing and explain how. You also have the option of selecting other. If there are other strategies that we have not listed that you plan to implement into your program to help with the admission of students, the support of students, or the recruitment of students in URM. Strategy question 4 will be criteria 3 of your application scoring criteria. This will be to encourage your students to practice in RNSAs, and you have these strategy questions above. As well, you have the option to do other if there are other strategies that we did not list and you believe is pertinent to the strategy question. And then strategy 5 is criteria 4 for your scoring criteria. And you also have, and that is to incorporate and implement culturally responsive care training into your program's curriculum. Again, you'll have that option to give a narrative of how you plan to implement those that you selected. So for new programs, if you do have training sites that your students can go to clinicals for, you have the option to select yes. If you have no training sites available just yet, you select no, and you don't have to enter any of this information. To add sites similarly to existing and expansion programs, you'll select add site. To delete, to delete or edit, you'll select that white box there. You will get the same pop-up or a similar pop-up where you will enter the training site name and the address and the NPI for your training programs. This is also a scored criteria for new programs. You will enter the expected or the anticipated expenditures that you are requesting. For RN new programs, you have a maximum of $1 million for RN new programs. For LM new programs, you have a maximum of $500,000 to request for your new program. You'll click Save and Next when finished. And the required documents I mentioned previously for them, just like the existing and expansion programs, they will be red if they are required. And once you enter the appropriate documents, they will turn green to let you know that they are uploaded correctly. So please pay attention to the red text at the bottom of each of these required documents, as they will tell you what is the prefix that you need to add in front of your document to make sure that they are uploaded correctly. They will be listed there, and you just need to copy them as they are. And I will turn it back to Chris.
All right, thank you, Cassidy. As you can see, the team's been putting a lot of hard work into this program, and we're really excited that you've joined us today to learn more. We are going to transition to our question and answer session. The chat option is now open and accessible in the menu bar at the top of your screen. We do understand that some of you may not be able to access the chat feature in the browser version of Teams due to organizations' restrictions. Some do find that the mobile version does provide access to the chats. If you're still unable to access the chat feature, please email your questions to songbrown@hcai.ca.gov. Thank you for your understanding. We are going to answer your questions in the order that they are received, and we will do our best to answer all the questions that we have today. And so let's jump in. Let's see our first question. How can we be innovative in securing additional grant funding, and what steps should be taken in our application to enhance our chances of receiving more grant funding?
Great question. So, as I said in the presentation, the scored criteria for the application will be training sites, graduates, and students in underrepresented medicine. So those are really the things you really want to focus on when you're completing your application. Make sure your training sites are all entered, and we want all training sites, not just training sites in RNSAs necessarily, but we want all training site information within the state of California. So please just make sure all of your scored criteria is inputted accurately. The grant guide that we have posted on our website has a more in-depth description of what we're looking for in this application. It is a very competitive application, so just try your best to give us all the information that we need to kind of give you the best to give us the best understanding of your program. So read the grant guide on our website. It has a lot of information on there about what we're looking for and the statutes of Song Brown.
All right, thank you, Cassidy. Renee asks, is the portal built that data entry for our login can be completed by two people simultaneously, or can they override? Does it constantly refresh?
Okay, so the program director will be the first person to initiate the application. The program director is the only person who can initiate the application. That is the person who is assigned to the program director. If you are a new applicant, you will create your funding portal profile, and you will send us an email at songbrown@hci.ca.gov to let us know that you are the program director for your application. From there, the program director can assign any grant preparers who will assist with creating your application or entering any information into that application. Nothing is overrided unless, of course, like the grant preparer fills something out and changes it. That's the only time it will be overrided. But the program director will be the one to initiate the application, and any grant preparers that you assign as a program director will have access to that application. So make sure that your communication is correct, and the program director will be the person who will submit the application as well. So you do have a chance to go over it again to make sure that information is correct.
All right, thank you. Next question. The application cycle scoring states 2022. Is it still unchanged?
Just to clarify, is that the scoring explanation criteria on the website? Is that what we're asking about? Yes.
Yes.
Okay. So that will be updated. We're working on getting that uploaded soon with with the breakdown of how scoring works. So be on the lookout for that on the website. It will be posted there in the next coming weeks.
Thank you. Matthew asks, when is the application opening for the LM?
The LM application is open now. It has the same deadlines as RN. So all of the deadlines for LM are the same. So October 24th, the application opened. Early deadline or early submission is November 21st, and the final deadline is December 5th. All of those will be at 3 p.m. And please check our website for any updates if needed.
All right. Daniel asks, we are an existing program that is seeking to increase enrollments. Would we submit the new program applicants? Also, would we be able to submit for two separate options, RN and midwife?
So if you're an existing program and you're seeking to increase enrollment, as long as you have an expansion approval from the BRN, you will select existing and expansion. So you can select both or one or the other, whichever you would prefer. So you would not select new program applicant unless you have never applied for Song Brown before, of course. But you would select existing and expansion if you are increasing your enrollment slots. And then if you are, yes, so if you have a licensed midwifery, not a certified nurse midwifery, if you have a licensed midwifery program as well at your institution, you can submit two separate applications for RN and licensed midwifery for this cycle.
All right, thank you. Let's see, next question. Can more than one program apply even if from the same school of nursing?
Would that be, can you provide more information on that? Would that be RN and FNP perhaps, or is it just two separate nursing applications?
It says AS, BSN, and pre-licensure.
Okay. To answer that in more detail, can you please send us a question? Can you please send us an email at our email? Provide some more information on that. I will get back to you with a more in-depth answer on your question.
All right, thank you, Kathleen. Wendy, the email is songbrown at hci.ca.gov. Okay, next question. Is there a maximum number of students or training site entries?
There is not. It is as many students as you have enrolled, and as many training sites as your students go to for their clinicals. So however many training sites that your students go to, and as many students that you have enrolled in your program, that is what you would enter.
All right, next question from Bob. That's, can we upload lump sum data in Excel or like format versus one by one adding of information?
So unfortunately, no, you cannot upload in Excel. It would have to be one by one for this application.
Dr. Eric Williams from Santa Monica College asks, can long-term care facilities be listed or just acute care facilities?
I will provide, so for that question, can you please provide more information on that? Send it forward to our Song Brown email, and I will be able to answer that question in greater detail after some more information is provided.
All right, thank you. Carrie asks, our RN program is in the process of adding a program option for concurrent enrollment where students can earn ADN and BSN concurrently. This is a consent item and no letter from the board that is approved. Is this a possibility for expansion grants?
Great question. That will be a question for my supervisor, who I do not think is here anymore. Kim, would you mind answering that question if that's something that we can do for this grant?
Sorry, looking at the question now. Program is in. This is a consent item and no letter from the board that is approved. Is there any other documentation or letter that you can submit to us? And if you can, I think that would help us be able to make a determination. If you can go ahead and send what you have to the email.
All right, thank you, Kim, for speaking up on that. Yeah, so Carrie, go ahead and send us an email with the information that you have, and we'll be able to help you out on that. All right, let's see. Next question. Calm's LM program proposal includes stacked certificates. Is that something the applying college should include in the application?
Yes, so if it is any documents that will help support your organization's application, you can upload that accordingly on there. Make sure to title it as such so we know what we're reviewing. You would just need to upload it to sustainability letter section just so we have more information on your program's application. So just add that with all of your other documents. You're not limited to just one document per section in the required documents. So if that's something that you want us to see, you can definitely upload that as well.
Perfect, thank you. Jessica asks, if an organization plans to submit by the November 21st deadline for early review, how soon would feedback be provided? Is it before the December 5th deadline?
Great question. Yes. So typically I will provide feedback within a week from your submission, between 7 business days, I should say, from when you submit. It will be before the December 5th deadline because it is 2 weeks. You have 2 weeks in between. So I will make sure that it is before that December 5th deadline. So typically I will get back to you within 7 business days from your early submission.
Okay. This is also from Carrie from earlier. The 21-22 and 2022-23 academic years, we admit 60 students biannually, once in January and another in August, and we graduate in May and December. How should we break the numbers down?
Okay, so how I've been explaining those breakdowns. So the May and December. So the December and May graduates. So let's say December 21, May 22 will be under the 21-22 graduates. And then December 22, May 23 will be your 22-23 graduates. Does that answer your question like accurately, or does that make sense, I should say?
You got it? Yeah. All
Yes.
right. Thank you, Kathleen. And thank you, Carrie, for that clarifying question on that. Sarah asks, do we press submit to submit by the early November 21st deadline, or does this make our submission final?
Yes. So if you're doing early submission, you will submit it. If there's any changes that you need to make, I will reopen your application for you. So I will inform you that your application has been reopened for you to edit, and I will do that on our end. So yes, please submit your application if you're doing early submission. That will let me know that you're ready for it to be reviewed.
All right. I've got a clarifying question from the earlier one for Renee. Just to clarify, can two grant preparers be working on the data entry at the same time? So we have a director and two grant preparers with their own logins. Can they enter data simultaneously from one organization?
Yes, you can. I just suggest that you review your application before submitting to make sure that there weren't any duplicates or any mistakes that were made if more than one person is in the grant. Sometimes it does happen. It's fairly common for there to be duplicates in graduates or in training sites just because there's more than one person entering the data. So just please review your application prior to submitting.
Jessica asks, what is the time zone for the 3 p.m. deadline?
That will be Pacific Standard Time for all of those 3 p.m. deadlines.
All right. Bob asks, if instead of utilizing grant funding for our program expenditure or expenses, can we use the funds to provide scholarships to applicants to enhance accessibility to students in those focus areas?
So Song Brown grant funds are not allowed to be used for scholarships for students. We do not allow for student scholarships or student stipends for our grant.
All right. Alfredo asks, will you be able to provide this Q&A or access to this webinar, including the Q&A portion? Yes, we will make the recording available. Typically takes us 7 to 10 business days to make it accessible and post it to our website. So check back about 7 to 10 business days. We should have it posted. All right. Let's see. Belinda asks, are we only listing clinical training sites for RN programs? Should we list training sites for our respiratory EMT VN program?
So it will only be the training sites, the clinical training sites for your RN program and your RN students.
All right. All right. Tammy asks, will the PowerPoint be available? Yes. In fact, this is a good chance to mention that all of the links that you need are actually pinned to the top of our chat, and we'll repost it in here as well. And you can see in there we have the link to our Song Brown page, to the RN grant guide, the LM grant guide, to our funding portal, to the technical assistance guide for it, the Song Brown glossary. And on the website, you can find, on the Song Brown website for this, you will find this slide deck posted there for your review. And same place that you'll find the recording, like I said, in about 7 to 10 business days.
Mm-hmm.
So.
And just to specify, this particular slide deck in the website will be listed under RN and LM Technical Assistance Guide. It will be the same information, same slide deck. There's just a little bit more information on there in terms of registering for the funding portal, but it is the same slide deck under the RN LM Technical Assistance Guide, as Chris mentioned.
Perfect. Thank you, Kathleen.
Mm-hmm.
Okay. Are there any changes in the overall amounts to the Song Brown grant May fund next year? We heard there may be cuts.
So the available funding for this cycle is listed in your grant guides that are available on the website, and that would be $2,725,000 for this cycle. So that is the available funds for this application cycle as outlined in the grant guide on the website. And then any payment breakdown will also be on that grant guide that you can view now.
All right, thank you. Tracy asks, what type of approval from the organization is needed for the new pre-licensure RN education program? Is this a letter from our president, or does it need to be a document from the Board of Trustees meeting?
So the sustainability letter for new programs is just telling us that you have support and funding outside of Song Brown grant funds to make sure that your program can operate and run without our funds. Typically, it could be from the president of whoever is going to support your program outside of our funds is where the letter should come from, whether that be your president or the board of trustees. It's kind of just whoever will inform us that you have support outside of our funds.
All right, thank you. Renee asks, under the graduate slide, there is a button for data reviewed for accuracy. Can you clarify if that is only appropriate for programs who have had past graduates pre-populated, or is it the program's career placement verification process?
So the data reviewed for accuracy button is just to ensure that you've gone through the training site or graduate again to make sure that all that information is accurate, and then you'll just select yes or no. If you select no, it will push it up to the graduates with errors section, and they will not be counted towards scoring. So you want to make sure to review that information, make sure everything is correct, and then select yes in data reviewed for accuracy to bring it down to the graduates with no errors, and that those graduates will be included in the scoring section of the application.
All right. Yeah, let's see here. Thank you, Cassidy. Eric's asking for the email address. I reposted that there. You'll find the contact us, songbrown@hci.ca.gov, and all of the other links are in there as well. So, all right, follow up to the Board of Trustees documentation question. Our next board meeting is November 12th, and the one after that is December 3rd. I'm not sure what the question there is.
For your sustainability required letter.
Tracy said the question's answered.
Oh, okay.
Thank you, Tracy. All right. Let's see. Carrie asks, thank you. We could submit our information that I'm assuming this is BRN requires for the notification and consent. Would that work? ADN and BSN concurrent?
I think that's a follow-up from what we said earlier.
Oh,
Okay.
that's a follow-up. Thank you. We can submit it. Yeah, can you email us to what you have so we can take a look at it also and let you know if that's going to be sufficient? Please. Thank you.
All right, perfect. Let's see. Kendra asks, is the number of students only the total number of students that are currently completing clinical rotations, but would not include the first-year students?
So that would be any of your enrolled students. So enrolled first year and enrolled second year. They don't have to be in clinical rotations at the moment. Those clinical rotation sites are just what you have used in the academic year 23-24. So your enrolled first year and enrolled second year students are what we're looking for.
All right. And Bob, Jamie, and Sarah all say thank you so much for this. And we're glad that you guys are finding this helpful. That's exactly why we do these webinars, is to make sure you guys get the information that we need to be able to be successful in applying for these programs. So glad that you're finding them helpful. All right, next question. Belinda, for program expenditures and funding, should we enter expenditures for RN training program only? I think we answered that one, right?
So this is a different question, but yes.
Okay.
It should be for the RN training program only. So any expenditures that you used for your RN program is the only program expenditures and funding that we are looking for from 23 and 24.
Okay. All right. Thank you, Belinda, for that question. Is the $2,725,000, is that for all the programs or max for each program possible?
So that is for all programs. For this cycle, it is very competitive this cycle. So it is 2.725 million for all programs. That will be divided accordingly based on the awarding that we do. So again, it is a very competitive application. So please make sure that you have as much information as you can for your RN programs and that all that information is accurate. Because that is how we score. So read the grant guide and the scoring guide once that is uploaded. They will provide all the information on what we are looking for and what we are scoring in your applications because it is extra competitive this cycle as we are only have 2.725 million. So that is for everyone. That is not the max for each program. The max for each program is 30 students times 15 per student slot. So 2.725 is for all programs.
All right, thank you, Kathleen. All right, well, working through the application, if we save and go to next place of entry or we save and exit, can we go back to correct any previous entries?
Yes. So if you save an extra application, please make sure to do that after every page. You can go in the funding portal, you will see a blue ribbon. You will select grant applications and then select the program that your application is for. So Song Brown Registered Nurse, you will find your applications listed there. So anytime you exit the application, you will re-enter it from there as long as you have not submitted the application yet. You will be able to access it there.
All right. Let's see. Lorraine asks, is funding reported for the RN program overall or just the funding that was used for Song Brown 2023 through 2024?
So the funding reported in the program expenditures and funding page in the bottom section, that is for your RN program overall. So anything that you spent for your program in the academic year 23-24 will be reported there. That's just to tell us how much funding is required for your program and if our support is equal to or greater than that expenditures that you did in the previous academic year.
All right, perfect. And then Sarah asks, what was the available amount last year for the RN program to be able to compare the amounts?
Last application cycle, it was $27 million.
All right, thank you. Bob asks, is the 2.725 for each year of a 2-year grant against the maximum of the 450,000 for any one program per year, or is the 2-year total of 30 students times 15,000 each times 2 years at 900,000?
So the 2.725 million, is going to be the total we can award for all programs. So that will be divided accordingly depending on who we award the grant funds to. And then you will get a number, you will get an award amount, and that will be for the total grant. You'll see once in the sample grant agreement in the grant guide, that will kind of break down what that looks like in the grant guide and the attachments at the bottom, but the 2.725 is for all programs. That is the available funding for all RN programs.
All right, thank you. Let's see. We've got plenty of time left in the webinar, so if you do have more questions, please go ahead and keep them coming. These have been great questions so far. And again, this is exactly why we run these webinars, is to give you guys a chance to get any clarification that you need as soon as possible so you can get working on your applications. Once again, you can find all of the links in the chat. We've got the Song Brown page link, the grant guides for both RN and the LM program, link to the funding portal where you'll actually log in to do the application, the TA guide, which includes the slide deck and then the Song Brown glossary. And then once again, please submit any additional questions you have to songbrown@hci.ca.gov. Let's see, here we go. What are some examples of direct expenses that would be reimbursed?
So some common ones is personnel. So any staff that help support the direct education and training of your students. Um, any operating expenses for $500 and below that support in the education and training of your students. So really anything that are any expenses for your program that directly support the education and training of your registered nurses or licensed midwives are would be reimbursed with our Song Brown Grant Fund. So um, uh, what was it called? Like clinical instructor stipends would be a part of that. If you have any modules that you need to purchase for your students to help with their training, that would be reimbursed. Any of like the CPR dummies that you might need to buy, any lab equipment that you need to buy for their education and training, as long as it's for the program and the students can use it for their education, it should be reimbursed. If you have any questions on specific line items, you can email us at our Song Brown website or our Song Brown email, and we can provide you more information if you have any more like in detail questions about those expenses.
All right, thank you. Next question. Matthew says, send an email to request program director role. How long to confirm and gain access to be able to apply?
Typically I can get back to you within the same day. We have someone monitoring our Song Brown web email, so they usually forward me all of those requests pretty quickly. So usually within the same day or the next day, I'll be able to get you on there as a program director so you can apply for the application.
All right, perfect. Let's see. Tracy asks, you showed a slide of how to calculate the number of students to the AY expenditures. Can you please go back over that?
Oh, that would be the program and expenditures page, Chris. I am not sure what page that is exactly.
Program and expenditures.
In the existing expansion section.
Let's see here. We can find that existing and expansion. Let's see. Program description, data. The program expenditure page.
Yes.
I believe it's slide 24. Is that the right one?
Yes, there we go. So let me see your question, make sure I'm answering the correct thing here. So for existing slots, you will select the number of students you are requesting with a maximum of 30 students. That will be multiplied by the $15,000 per student slot, and that will give us the total for that academic or for that request. Same thing for expansion. You have expansion slots. You will select how many expansion slots, and then that will calculate there. Oh, I see their clarification on the bottom, Chris. So yes, for this bottom section here, for the enter the academic year 23-24, that will be your previous academic year 23-24's expenditures for the RN program. So it will be, yes, that section there will be for your previous application or your previous academic year's expenditures.
Bob asks, if there is a strategy, would you be trying to get a maximum number of programs, some funding, or a lower number of institutions, a maximum amount of funding? For example, from the 2.7 available, 3 schools, 900,000, or 9 schools, it's 300,000, as an example.
So we will review all applications and we will award accordingly. So how we believe the scoring kind of plays out, we will score the institutions and the programs, and based on how they match the URM criteria or the 4 criteria for the application, we will award accordingly. So we don't really have like we will award X amount of people, for example. It's kind of just going to be a discussion between our team to see how we want to divide those fundings. I'm sorry that I don't have a specific answer to that question, but we will review everything and take everything into account and then award accordingly to make sure that we can support as many people as we can.
May I jump in there, Cassidy?
Yeah, of course.
Yeah, so we provide several recommendations to our leadership, or ultimately our deputy director. And because it is such tight funding, typically in the past, we've tried to do a tiering method where we will try to award more programs funding if available, based off course scoring, but we do put several recommendations through to our management for them to approve. So typically in the past, we have tried to spread out the money as much as we can amongst the programs, but unfortunately we are down to 2.7 million this year. So.
All right, thank you, Kim and Cassidy, for that. Renee asks, does your portal have all the NPIs for the placement sites?
It should. So it's the actual NPI website that we have linked in the application. So it actually take you to the National Provider Identification website. So it should have everything because it is the NPI's actual website. And they should keep track of all of the NPIs. So it should have all of them. If not, typically you can reach out to the training sites or the practice sites for the graduates and ask them for their NPI number if you're having a hard time looking for them. But because it is the actual National Provider Identification website, it should be there. If not, again, reach out to the training site or practice site for that NPI number.
All right. And Sarah asks, do you anticipate the amount will increase again next year?
I think that we wish. Right now we haven't heard anything. We did have, we went through a budget crisis this year, right, with the deficit in California. So they took a lot of funding away from our programs, and one of them, they did take 15 million away from RN last year. And so all we keep telling people is go to your legislatures, fight to get that funding back. We have no control over it, but that's what we encourage you to do. That's how they got the additional funding in the first place a couple years ago, was 3 years ago. So that's what we encourage you to do, just go to your local legislatures and try to fight for that additional funding. But as of right now, I haven't heard of any additional funding coming in next year. Sorry.
They didn't give us crystal balls when we started our work with the state, unfortunately.
Yeah.
So one last clarification on that. Based on the shares so far, what's been shared so far, that 2.725 is available. That's the total available for both LM and RN, correct?
Good question. So no. So RN is the only application or the only award that will come from the 2.725 million. LM has its own budget for their awards that is shared with our other midwifery. So RN is the only grant going for the 2.7 million. LM has its own budget for awarding, so they do not share that 2.75.
I already anticipate what the next question will be. What is that? There it is. the amount for the LM.
That'll be $396,000 for the LM.
All right, thank you. Okay, well, we still got a little bit more time. You guys have been asking great questions today. We really appreciate just the interaction and all of the participation that you guys have been doing today. If there's any other questions, I'll give another 30 seconds to a minute here to get those questions in before we transfer over to the next part of the webinar, which will be our closeout. Yeah, if you have anything else, just a reminder to check out the website and go to visit all of the links that we have. If you have any other questions, again, email us. Let's see, 2.7 million for private and public college nursing programs.
Yes, so that is any RN programs that apply. So that they will all be pulling from that 2.7 million budget.
Yep. All right. And once again, just a reminder that within 7 to 10 business days, we will have the recording of this webinar, including this Q&A session, posted to our website under the Song Brown, same place that all the other resources are. So you can come back and look for that within 7 to 10 business days. So, all right. Well, looks like we're coming to the end here. So thank you all for your participation in the Q&A session. Again, great questions, great interaction. We really do appreciate that. If you do have more questions, do email thesongbrown@hci.ca.gov and be looking for all of the postings on the website. We do appreciate everybody joining us today to learn more about Song Brown Registered Nurse and Licensed Midwifery. We are excited to be able to offer this as just one part of all of the health workforce development efforts at HCAI and are grateful for your participation with us today. We have some resource slides for you. I'll go ahead here. You can please follow us. Make sure, again, check out the website for all of the resources. You can also stay up to date with us on Facebook, LinkedIn, Twitter, and YouTube. By the way, if you guys are doing great things and with the money that you have been awarded, post something on social media and tag us in that. We are HCAI Health Workforce. Any of these tags, you can find our posts, but we also encourage you to use those tags to tag us with anything that you're doing with the funding that we're providing for you guys. And then next slide, we have our newsletter. Please, if you have not done so yet, please sign up for our newsletter. We send this out monthly, and it's a great way to stay up to date with everything that workforce development is doing through HCAI. So go to our webpage, sign up for that. And if you do need to contact us and email's not working, you can always call us at 326-3700. That is 916 area code. As a reminder, the application cycle closes December 5th at 3 p.m. Make sure we get our applications in before that. And with that, thank you so much for attending. We conclude today's webinar, and we hope you all have a wonderful day. Thank you.